It's my pleasure to introduce Mr. Nathan Dallas as the county's Emergency Services Director. Many of you will recall Nathan worked with the county previously years ago in the Emergency 911 and GIS department. He later became the Director of the Fire and Emergency Services program at Blaine Community College, and most recently he's been working in the private sector. He has been very involved and active in leadership roles in the Fire Association here in Blaine County for years, going back, I think, to his teens. And so we're glad to have Nathan on board with the county. He actually began his service last Monday, and so he's already hit the ground running. So welcome, Nathan.
Hey, got a speech prepared? Okay. Matters of interest, Commissioner, anybody have anything tonight?
Yes, I have two things.
Alderman Goins?
The first one is concerns about our trash here in Blaine County. A lot of trash. Several of the outlying areas, some of the workers are saying that they have vehicles that are coming in quite often bringing their trash, but they're not Blaine County residents. So that is something the workers and even some of the citizens are complaining. People bring so much trash in on their area, and asking that maybe that the county could provide stickers for the vehicles or something, but no cost to them. And maybe this will also balance out with the reduced amount of trash that we are paying for transportation or whatever. And we get a job sometime, at least the first year. I looked at it and thought, some counties have their stickers when they pay their taxes, they mail them out, at least 2. And then some when they do the VMP registration. But that's a way without people having to come get them. And at a separate time. So they pay the taxes, so I'm sending those out the taxes they pay, they'll get the same thing. But no cost to them.
Mr. Martin, look into that, thank you.
Right, that's number 1. Number 2, I like to read I'll pass this around. I like to read this letter. On July 22nd, 2019, Blaine County Commissioners, everyone has one. Yeah, Blaine County Commissioners and Town Manager, or County Manager. Dear Commissioners, in your May 2019 board meeting, it was stated that the county had put the Blaine Community College extension in East Arcadia. We thought we were aware of how this was financed, but to ensure that we are not mistaken, we investigated the source of the funding. The Blaine Community College extension was obtained through a state bond, not funding for the county. So they wanted to make sure that was corrected in the minutes. We feel sure that the misinformation was not intentional, but felt that the record should be set straight. The town of East Arcadia looks forward to working with Blaine County Commissioners on future endeavors. Respectfully signed by, respectfully yours, Mayor Perry Blank and East Arcadia Council. So I want to make sure that is corrected. Thank you, Mr. Chair.
Mr. Chairman, I got it.
Mr. Rowland?
I don't know how they asked this, but I'll forward this to Mr. Martin. A citizen asked me about the CDB grants. Was anything open for bidding? I don't know what he's talking about. I know about the grant. Do you know if anything open for contractors to bid on?
I know we just recently had, and Greg Elkins is here, we've recently accepted bids for, and we actually had to advertise twice. I'm not sure if that was CDBG or CDB.
But you talking about for actual contractors to actually bid on the projects?
Right.
Yes, that is, those advertisements are out now, and I think the,
Contract leaves August 11th, I believe.
August
Well,
11th. yeah.
well, but Mr. Bullock, I received a call from the folks who are right across the river between here and White Lake. I don't know if that's who you talked with.
No, the guy called me and said he had some individuals that wanted to bid, so could you email that information to me?
Yeah.
It's not, I will tell you, that's not through the county, that's through the state. I went to the state website trying to help these folks find the information, and I learned a lot doing that. But on the state website, and Greg will share that with you, is a place for vendors to inquire if they're interested in providing services or whatever. So that the CDBG is through the state,
Okay.
as I understand it. And so.
Okay, get
So
that
you
to
want me to
me,
email you that, the bid packet, or the,
the whole, whatever it is.
I got you.
Okay, thank you, sir. Thank you, Mr. Chair.
Please send it to all commissioners. Anyone else? Item 5, individual delegation wish to address commissioners.
There's something else in the matter.
4A,
Matters of interest.
4A.
Oh. Must be working off old agenda. 4A. Okay, entertain a motion to approve the minutes for June 7th, 2019 special meeting. Is there a motion to approve?
I second.
Motion by Mr. Gibbs, second by Mr. Brett. Any discussion?
I got just one little small thing I thought that was concerned. If Ms. Peterson, could I make sure that I'm understanding? If I was to exit now and leave, do we need to, anytime we exit, say we are asked to be excused?
You have to get approval from the board
No.
to exit, so your vote will not be counted as a yes.
Okay, but what I'm saying is, okay. So if I leave out, anytime any of us leave, unless you've been excused, your vote will count as a
Right,
yes.
right.
But if I ask to be excused, then what effect would that have?
I'm not gonna excuse you unless you just got to go to the bathroom.
That's what I'm saying, so-
Yeah, if you got to go to the bathroom, I can excuse you for that, I'm sure.
Okay,
But
I
if
just
you
wanna make
leave
sure.
the meeting,
No.
help me,
I
Greg,
think the board would need to vote on that.
if you went to the bathroom?
Well, I'm saying to be excused, if you were in the matter of discussion and it came up for a vote while that person was not there.
Now, I want to make sure.
Yeah, but you can't-
I was just trying to help you talk to her.
I know. I just looked at Josh, that's why I looked at what was written up, and I'm
Talk to him.
saying,
He's trying to help you be quiet.
I wanted to make sure. That's
Carry
all.
on.
I'm good with everything.
All right.
I'm good with everything.
Okay.
If he just got up
We didn't tell them before voting.
If you need to go to the bathroom, ask me, I'll recess.
I'm good with it. Because I just want to know if somebody was voting or something, that's all.
I'll recess. Okay. Leave for a minute or two.
Okay, all right.
Okay. Am I 5 individuals?
We got to make the motion to prove that.
Oh, I made a motion. Everybody in favor, say aye.
Aye.
All opposed? Okay, we're good. Now I'm at 5. Individual delegation wish to address the commissioner? Okay. 6 is Health and Human Service Agency, Ms. Terry Duncan.
And we have just a few items coming before you tonight. The first one is considering approving the Bladen Healthcare LLC with Paper Valley. These contracts provide X-ray services for TB patients, medical direction and supervision for the nurse practitioner, along with professional supervisory services for registered nurses working in the clinics, to include communicable disease, lab, and OD professional services to health department maternity patients.
Motion by Mr. Britt, second by Mr. Cogdell. Any discussion? All in favor, say aye. All opposed? Item B.
That actually is one of the services that is provided, the same thing for the pre and postnatal postpartum services, same services as that I just read before.
Motion by Mr. Britt, second by Mr. Cogdell. Any discussion?
I got one question, Mr. Chairman.
Okay.
Ms. Duncan, do you have any questions or concerns about any of these items?
No, sir.
All right, thank you.
All in favor, say aye.
Aye.
All opposed? Item C.
See, I explained that that's the X-ray services for TB patients.
So move.
Mr.
Second.
Cogdell, second by Mr. Bullock. Any discussion? All in favor, say aye. D.
D is the contract between Bladen County Health Department and the Bladen County Public Schools to provide understanding, give directions, and establish responsibilities for the school health program.
So moved.
Dr. Bullock, second by Mr. Cogdell. Any discussion? All in favor, say aye.
Aye.
Item E.
The next is the school health addendum, which gives specific funding that's paid to the school system for school nurses for that purpose. And this is pretty much a pass-through for the money it goes towards their salaries.
Second.
Motion by Mr. Trivett, second by Mr. Bullock. Any discussion? All in favor, say aye.
Aye.
All opposed? F.
Next is the North Carolina Public Health Association Memorandum of Agreement, and understanding the business associate agreement for Medicaid cost report consulting services.
So moved.
Motion by Dr. Oakley, Montgomery, second by Ms. Trivett. Any discussion? All in favor say aye.
Aye.
All opposed? G.
This is the on-target preparedness contract to prepare, plan of response and action for bioterrorism or a pandemic event that is mandated by the state of North Carolina.
Motion by Mr. Britt, second by Mr. Cogdale. Any discussion? All in favor say aye.
Aye.
All opposed? H.
This pharmacy contract is with Dickerson's to dispense family planning, STD and TB medications from our stock that is supplied by the state of North Carolina.
Second.
Motion by Mr. Trivett, second by Mr. Cogdale. Any discussion? All in favor say aye.
Aye.
All opposed? Aye, please.
And the final one is the medication assistant program contract gives assistance with providing medications to low-income individuals.
So moved.
Motion by Mr. Bullock, second by Mr. Britt. Any discussion? All in favor say aye.
Aye.
All opposed? Item 7 is thank you, Ms. Duncan. Department of Social Service, Vicki Smith.
Good evening. I bring with me this evening Lisa Nance, our income maintenance program manager. She will help or assist with our presentation this evening. We are here this evening out of a suggestion by the state from our corrective action plan with the adult Medicaid unit to report at least quarterly for some time to the commissioners of our progress that we have made. Since we have entered into our corrective action plan, we have been completing monthly audits in adult Medicaid by our personnel there on site. The finance office, they continue to come in and do monthly audits to assist us as well. We have several new workers that upon their employment, we have the luxury of them attending adult Medicaid training through Cumberland County DSS. They have their own training pool. It's specific for adult Medicaid. So they have obliged us to send workers there. And we also have a new supervisor that onboarded today with adult Medicaid. Ms. Nance, we have some graphs that we want to share with you that will show our progress. And I think you'll be pleased with the progress that we have. Ms. Nance?
The first slide that you see are technical, the technical audit that we did on the applications completed for the months of April, May, and June. You can see some flowing of numbers. The lettering across the bottom indicates the employee. Of course, you'll see in the middle of the graph, in the area of D and E, that we don't have some shaded areas in the red, and that's because of employees in vacant positions at that time.
So the best at the bottom is reflective of an employee.
Yes, and that is their scoring. As you'll see in blue, you'll see the April, the red indicates their May scores, and then in June, their scores in green.
So one employee would have anything in there.
Right, we do have some vacancies in the department. So that's technical under our applications. Next, we have our technical for recertifications. And there again, you see in the blue, the results from the audits from April. The red indicates the May figures that were achieved, and then in green.
So are you saying like the employee D didn't do any,
Didn't have any information there for May.
I mean, they didn't do any or just did?
There was a vacancy in that position during that time period.
I thought the letter, I'm getting confused, I thought you said the letter was up to stand for employee. If D's an employee and they got blue ratings and no red ratings and green ratings, that's what I'm trying to understand, why no red ratings?
If we filled that position during that time, it could be that it was a crossover from one employee to another employee.
So that person was training?
Possibly. And it could be that that person did not have any information for that time.
See, so on your first draft there, A employee did not have anything reviewed.
That's right. That's correct.
So how do you go about getting your sample?
Samples are randomly pulled, supervisors pull numbers, and they pull, from the last digit that's pulled, they pull that number from the case for the application that they randomly got.
Would every employee have sample pool?
Yes.
Apparently not.
Technical errors would be things like, if you send a form out and maybe possibly put an incorrect date. Those are not eligibility errors, they're technical errors.
My question, then will every employee within a 6 month period be evaluated? Yes, or at least every?
That's how it goes.
So does the blue represent one program and the red represent one program and the green
Those are
represent?
your months. That's the month that was audited. The blue represents April, the red indicates May, and the green is for June.
So you saying that if it don't have a color, then it doesn't have nothing on it?
That's right,
Oh, okay. That's what I was trying to figure out.
that's right.
All right, thank you.
Okay, and then we'll move into eligibility. The first draft is for our, applications that were monitored. Now, your eligibility is, information such as income that is keyed into the system to determine whether that client's eligible. If we make an error there, of course, that could cause a county payback. So eligibility is our critical area that we're desperately wanting to improve.
To keep everything, to keep all the employees in compliance, my question is, how often do you notify them with that they're out of compliance and not compliance? How often do you do that?
Monthly.
Monthly, so.
Once their records are checked, they're notified. And the county also has the finance officer comes in and audits as well in addition to these.
So do the once a month meet the criteria to keep them paying fines?
Yes.
It will meet the criteria to keep them paying fines.
Well, these are internal audits that we're completing. They're not actually done by the accountant or the county or the state.
So
And that would be the area that would produce any paybacks.
So during the time of this, you have time for corrective action to make sure they're not picked up by
Yes, sir.
the state complaint.
So the red line going across is the state, average.
That is our average of
Oh, our
95 that we're trying to make sure everyone's achieving. And you can see that we have their own applications. We had a problem in April, employee B, but we strongly came back in May and June. With the blue and green, the red and green, excuse me.
Let me ask one last question. I know I'm kind of confused. I'll make sure I understand. If we looking at A, B, C, D, E, F, we got about 2, 4, 6 employees, and 7 with the one on the end. So it's a total of 7 employees that you are assessing every month. Is that what we're saying?
At this point,
7.
Potential 7, some of them.
Some of them are vacant. That's what I'm asking.
some
How
of
many
them are vacant.
So you don't
Some
have,
of them were lead worker positions, some possibly were, we do have an employee who stepped in a supervisory position and then made the decision to move back, so she was not audited during that time, she was part of our auditing process.
so right now you're understaffed.
Yes.
By how many employees?
One,
Just 1 employee?
H, G. Well, what was A, C, and H, data?
There might be vacant slots, there not, no employees there.
Well, she said you,
Those are vacant.
well, she said you had one, she's on one this month.
Today, right now.
Oh, okay.
This was from back April, May, and June.
Okay.
So that was,
So you have filled some of the vacant slots.
some of those are the ones that are in training and
With the
coming
exception of
on,
one.
with the exception of one. Those interviews will, or that interview for that position will take place this week.
and lastly, you see the eligibility audit for our recertification.
Before you go back, what do you do to keep below that 98%? What do you do?
that are below the 98. Well, that's when we have conversations, make that, attempt to let them know what we expect.
Do you send them back to remedial training or anything?
Yes.
And after that, do they have like a mentor while
They have a lead worker in the program that is there for them, yes.
I'm sorry, you mentioned
And then lastly, you see the eligibility audit for your recertifications. There again, we had, 2 employees that were at 96 and 97 in the month of April, but everybody has strongly come back in the months of May and June for eligibility. And again, these are internal audits that we complete, each month.
So,
From the work they have done.
are you conducting those internal audits?
I do not. It is handled by the program supervisor or lead worker.
Program supervisor, or me?
Rick, I personally want to commend you, because you come up with a program that seems to be working. I like the chart. It shows how hard you are working, and, I personally want to commend you for what you do.
Thank you, ladies.
I have one question.
Something to it.
When, finance or state come in, have they come in and do an evaluation, an audit, and resulted in any findings?
We've not had any fines. Now, the corrective action that we had was some concerns. There were no fines with those concerns.
Okay, so we had to send the money back,
No.
nothing like that. That's good job.
That's what we are working
And
hard
that's
to.
good. That tells you.
Ms.
Okay.
Crocker?
With the new, right now they're looking at the new Medicaid reform type thing, legislation. Would that have any impact on your volume, or will the volume stay the same? Or like when if they increase the Medicaid that they're talking about doing, would that have any impact on your staffing?
It's hard to say because we do not know where it's going, what they have told us at this time. We only do the eligibility piece.
And we will continue to only do eligibility. So,
Right. They will have to choose a provider or a company that they want to be with. We cannot direct them on that information.
Okay, and last question, with the Medicaid, I've had a lot of people that's the adult Medicaid patients, since y'all here Medicaid, they're complaining about medication costs. Is that factored into any of the stuff that y'all do? They just asking me about it. They said everything, medication is going up, paying more. Is that something that y'all relay into them? Do they made knowledge of that? If somebody like don't actually know why it's happening.
are they Medicaid recipients?
Yeah, they get Medicaid, that's what they said, they get Medicaid. And they said all of a sudden, now they've got Medicaid with United Care and different agencies, and they said the medicine's going up.
It sounds to me like that may be a supplement to their.
Yes. And it's not just their medicine, it's their doctor visits as well.
Yeah, everything.
Yeah, all of them fall up with that, right?
It's not your basic.
No.
So y'all wouldn't have any
Medicaid.
control in anything to do with that?
Mm-mm.
Okay, I didn't know who they reach out to, but they were asking me, and I told them I had no idea.
And I have one comment. Now, we do know that we can't tell them, but we complain, because I was on that committee, and we talked about, especially in rural areas, they need help sometimes. We can't tell them who, but we can tell them they can select this, and if their old provider was with someone else, then you can let them know that.
And
See, so,
we have already been contacted by some of the companies.
Mhm.
They want to come to the agency to set up, and we are obliging that. There will be some community events as well, and we have shared our concerns, you know, with the rural areas that people don't understand. And we do know, of course, that if they do not choose a provider, they will automatically be enrolled, and they have 90 days to change.
that's right, that's it.
Thank you, ladies.
Mr. Chairman,
Appreciate it.
just got one question. Have you found that, some of these areas, have any of them have a negative impact on the citizens, like they have to pay back money or anything?
We've not had any that we've been contacted about.
All right, thank you.
Thank you, ladies. Ms. Lisa Coleman, Finance Department.
Did you get that better? As you know, we have finished June. Okay, all that has not been done, of course, so the figures only reflect as a picture as of June 30th. We still have September 15th to account for breaking revenues, such as sales tax is a big one, and DSS revenues and division of labor and some of the other grants programs. Anyway, so I'd like to go over what we are right now at June. We have brought in revenues of 80.08% and spent 83.29%, and that's in general fund. In solid waste, we brought in 80.46% revenue and spent 90.88%. Emergency telephone, we brought in 92.31% and spent 85.79%. In the water district, we brought in 100.83%, so they've done really good. And expenditures are at 92.66%. You have any questions about that? Thank you. Item B is, as you know, it's time for our contract again.
Where did sales tax come in at? You got those figures?
Yes, sir. Sales tax was in at 74% of budget right now.
What was that compared to what we thought was gonna be? You know that one? You don't have to answer it. Okay, move on. Item B.
We know it was $200,000.
Item B. I'm sorry.
Item B is, as you know, this coming December, we time for us to take banking service audits. We did have a statement in our last audit, our statement in our last RFP that said that we could renew with the bank for 2 years with no additional fees and that type of thing, just remain the same. We're very fortunate right now at First Bank. We don't have to have a compensating balance and we don't have fees. And they have agreed to extend it for 2 years and look at it possibly for another extension after December of 2021. So I'd like for the board's consideration on approving that.
Pleasure to the board. Motion by Mr. Britt, second by Mr. Gooden. Any discussion? All in favor say aye. Aye. Thank you, Ms. Lisa.
Thank you.
Mr. Greg Elton, planning director.
You have before you tonight the two resolutions that the Census Bureau has asked the counties and towns to adopt, and basically what these resolutions say, I'm not sure which one's first.
2020 Census Partnership.
This just states that, that, you know, the counties, is aware of the census. The counties, you know, gonna take proactive measures to make sure that the citizens, you know, are aware and basically just support the 2020 census. I don't need to read this or anything, do I?
No. What's the pleasure of the board? Motion by Mr. Tripp, second by Mr. Britt. Any discussion? All in favor say aye. Aye. All opposed?
I have a question. Are we not having a partnership with, is this the same partnership with the county commission? And if a county commission, who's working with you?
Okay, I know that I have you, because
Right.
when I did a presentation a couple months ago, you asked, you know, to be on the complete count committee, and I think you probably get the email too. We've had two complete count, well, that's what the next resolution is about, the complete count committee, which we do have established. We've met twice, and that's basically a committee of diversified group of people from the hospital to the media, to Board of Education, community college, government officials, to be able to, you know, to get together, talk about how, you know, how can the folks in the health care community get out and spread the word, you know, to their specific folks. Board of Education, get the word out to the kids at school. The media has been a big help. So we do have a complete count committee established. Our next meeting, I think, is August 22nd. We meet at the Agriculture Building at 10 o'clock, so I think that's on a Thursday. Have you been getting those emails? Okay, I must have a wrong email for you then, because you're on the list. Okay, well, I need to check that. And so that's basically what this next resolution is the complete count committee will, you know, work and partner with state and local officials to basically we want to ensure that we have a complete and accurate count, bottom line. And not only will it be the complete count committee that the county's heading up, but there can be a lot of subcommittees in the religious sector. You know, the religious community could have their own complete count committee. So we just got to get the word out.
Well, Mr. Evans, I have a lot of information that I obtained during the commission's convention, and I'll give that to you too at the next meeting.
Motion by Dr. Duffield on the going, second by Mr. Britt. Any discussion? All in favor say aye.
Aye.
All opposed? Thank you, Mr. Elkins. Ms. Renee Davis, Revenue Department.
Good evening. I have, 4 different bids. The first one is 4 acres on Rosinville Road, and it was, a bid came in on July 11th for $5,700. Investment to the county was $5,700, and consider to approve or deny that bid.
Pleasure of the board.
Motion to approve.
Mr. Cogdell, second by Mr. Gooden. Any discussion? All in favor say aye.
Aye.
All opposed? Mr. Cogdell, B.
I'd like to make a motion that we, decline bid B and let it be put out for a family
Private sale.
private sale.
Is there a second? Second by Mr. Bullock. Any discussion? All in favor say aye.
Aye.
All opposed? Item C, we remove, so we're D, Ms. Davis.
So, this is, Ricky T. Ring, a bid amount of $4,000 was placed July 15th, and, the county's investment was $4,000. Consider to accept or deny a bid of $4,000.
Pleasure of the board. Motion by Mr. Gooden, second by Ms. Trivett. Any discussion? All in favor say aye.
Aye.
All opposed? Item E, please.
Can I ask a question quick? I saw on this one, it says for the LLC, a holding in Wilmington. Is that for the guy, young man who, is it Cody? It's a young man who, from the area, from his family area, he's living there. So is that the same young man who applied for the water? Or is it from a, bank or something? You don't know?
I mean, I know the name, but I'm not sure if it's the same, it's a Mark Reeves. For Ricky T. Lane?
No, I'm on, E.
Oh, I'm sorry.
I'm sorry.
I'm sorry.
I need to take a recess. 5 minutes. Just hold off on it.
Because I need to call